Sinai-Grace takes a huge leap that you'll want to hear about. Do you know the signs of a stroke? And it's that time of the year. Do you know how to kick those winter blues? These stories and more coming up next on Sinai-Grace Today. Hello, I'm Melanie Moss. Sinai-Grace is doing a little pre-holiday celebrating. The hospital has been recognized as a Leapfrog Top Hospital for 2012.
Leapfrog is a national patient safety and quality program. We participate voluntarily. We put in our data from the previous year, and you have to meet certain criteria to qualify for this award. They talk about cardiothoracic surgery, valve replacement, acute heart attack care. They talk about how well we investigate safety issues, our use of the electronic medical record for medication safety and preventing of errors in that regard. This is all about the employees. This is every nurse, every patient care associate that is at that patient's bedside making sure our safety programs are working. This is our physicians and our senior leadership making sure that we put the programs in place that allow this kind of achievement to occur. We happen to score an average of an A overall in multiple categories, including patient safety, some of our cardiac surgery programs, and by scoring A, we have won the award. It's a big deal. This is a nationally recognized award, and when I looked at the results, I compared us to local, very popular, very well-known research institutes, and we compare favorably, as well or better as those big institutes. So I think it gives our patients and our community confidence that we're doing the right medical care at this facility.
The Leapfrog Award is an important distinction, one that Sinai-Grace Hospital looks to keep improving upon.
We'll continue to seek this national award. I think it's a very good recognition for our facility, and it keeps us working at a very high level.
Stroke is the fourth leading cause of death and the leading cause of long-term disability in the United States. On average, someone has a stroke in the U.S. every 40 seconds.
You can remember the signs of a stroke using an acronym FAST, and what that stands for is a facial droop, a drift in the arm, a change in the way you speak, or difficulty finding words. If you notice your loved one having any of the signs of a stroke, you should call 911 immediately because time is of the essence. Time is very critical if you're having signs and symptoms of a stroke, because for patients who come to the hospital within the first 4.5 hours of stroke symptoms, we have an approved therapy that can be given intravenously that can reverse their symptoms in many cases. Most strokes occur in middle-aged to elderly patients, and in this age group, the primary risk factors that contribute towards a stroke include high blood pressure, diabetes, high cholesterol, smoking, and an irregular heart rhythm, or a rhythm called atrial fibrillation.
While 3/4 of strokes happen in patients 65 and older, strokes can and do happen in younger people.
A significant proportion of strokes also occur in the younger population, but the risk factors in this age group are different, and they can be anything from cocaine abuse to a tear in your blood vessel, a condition called dissection, or to a tendency for your blood to thicken up and form clots. So controlling your blood pressure, quitting smoking, keeping your diabetes under control, taking your medications regularly for heart failure, knowing your cholesterol value and making sure it is under control are important steps that you can take to prevent your stroke risk.
Sinai-Grace Hospital is a stroke certified center with an emergency stroke response team available 24 hours a day. Sinai-Grace also has an outpatient stroke program in the professional office building.
Sinai-Grace Hospital has been certified by a national body called the Joint Commission based on strict standards for quality of stroke care offered at this institution. The outpatient stroke program at Sinai-Grace Hospital focuses on prevention and recovery from strokes. So a stroke specialist evaluates a patient with a stroke and determines what the underlying reason for the stroke was, and that helps us design appropriate therapies to help prevent future strokes. They also identify disabilities that stroke victims have to help them work with those disabilities so that they can integrate back into society. Part of the Sinai-Grace outpatient stroke program is also stroke prevention. So patients who have a number of the risk factors that we mentioned earlier can get a consultation with a stroke specialist on ways in which they can reduce their stroke risk. The outpatient stroke program at Sinai-Grace also sees patients who have had brain hemorrhages or brain aneurysms. So if a patient has long-standing headaches, or if they have a family history of aneurysms, they should consider getting an evaluation at Sinai-Grace's outpatient stroke program.
If someone is having a stroke, call for help or 911 immediately. To learn more about Sinai-Grace Hospital's outpatient stroke program, call 313-966-4800. New research finds not having a job is not just bad for your bank account, it's bad for your health. The study out of Duke University finds a 35% greater risk of a heart attack if you are involuntarily unemployed, and that percentage increases with each unexpected job loss. Researchers say that someone who has been let go from 4 or more jobs is 63% more likely to have a heart attack than someone who has never lost a job. If you feel you're at risk of a heart attack, contact a Sinai-Grace heart doctor at 313-966-4800. One out of every 6 women in the United States has been the victim of a rape. Leslie Harding says there's a program at Sinai-Grace Hospital that is reaching out to these survivors.
The WC Safe Clinic, or Wayne County Sexual Assault Forensic Examiners Program, has opened its doors at Sinai-Grace Hospital. Executive Director Kim Hurst says the mission is to provide compassionate care to victims of sexual assault.
The Wayne County SAFE program is the Wayne County Sexual Assault Forensic Examiners Program, and we provide comprehensive and compassionate services to sexual assault survivors in Wayne County. We provide 24/7 what's called a medical forensic exam, which is sort of otherwise known as a rape kit, where we have specially trained medical professionals, nurses, physician assistants, nurse practitioners who are specially trained to basically be able to perform a medical exam and collect evidence along the way, so that there is somebody who's specially trained actually doing the exam, knows how to collect the evidence, maintain a chain of evidence, and then again follow through at the end when it's potentially time to prosecute a case. The advocacy track of our services includes crisis intervention, where at the time that our medical staff is responding to a rape victim, we also have a specially trained advocate or social worker that's there to provide them with emotional support, counseling. Wayne County services are accessed in several different ways. Sometimes we're contacted by the police if that's where a patient first goes to report that the crime has been committed. Sometimes patients go directly to an emergency department, and so a lot of the time we're contacted directly by emergency departments that they've got a patient there that needs our services. The other way that we're contacted is directly by patients. We have a website, www.wcsafe.org, where all of our services are listed, and we have a crisis pager number where anyone can call that needs services. The crisis pager number is 313-430-8000, where one of our trained staff will immediately return the call and arrange for services to be provided. A few things are important for people to remember if they find themselves in this situation. First and foremost, that this crime occurs, and it's a crime, it's an act of power, and that this can happen to anybody: brothers, sisters, mothers, daughters, children. And the services that we provide to patients that are 12 and up. We provide the services within that first 96 hours after an assault occurs. That's the time frame for which that you can actually collect evidence. In addition to our medical services, we do also provide medications to help prevent sexually transmitted infections, things along those lines. We make sure that patients have access to medical follow-up as well. One of the other things that I think is really important for people to realize is that by coming to us and having an exam done does not automatically mean that they have to talk to police, that they have to file a police report. that option is up to them. The reason that we feel it's important that men and women realize that our services are here at Sinai-Grace is so that they can come here knowing that they get free 24/7 care by specially trained people, whether it's nursing or social work, to be able to provide them with the services that they need at such a traumatic time in their lives. We provide the compassionate care with special training and equipment that they wouldn't necessarily get in an emergency department.
To reach the WC Safe Clinic at Sinai-Grace Hospital, contact 313-966-4800. Comprehensive women's services are also available at Sinai-Grace Hospital by calling 313-966-4800.
Did you know that at any given time, 20% of Americans will be suffering from the symptoms of depressive illness? Those numbers seem to go up around the holidays and in the spring. Holidays are a difficult time for us. The days are short, we get up in darkness, we come home in darkness, and that can be discouraging, and that can enhance our sense of fatigue and hard work, whatever we do. Also around the holidays, we're thrown in with our families, and although we love our families and we like to see them and spend time with them, that kind of closeness brings intense feelings, and sometimes old rivalries, old hurt feelings come out, and that makes the time even more difficult. People do get discouraged, they have low energy, they have a tendency to overeat, they get less exercise, we're more busy, more rushed, there are more demands on our time, and all that leads up to sleeplessness, discouragement, and feelings of depression. The best way to deal with depression is to make sure that you're balancing your diet, high protein, low fat, low carbohydrate. Try to stay away from alcohol, especially in excess, and there are a lot of pressures to drink around this time of year. Lots of parties, lots of trays, lots of sweets. The other thing is get exercise. Physical activity is very important, and we tend to be lazy in the winter. We tend to not have enough time and be more rushed, but physical conditioning, healthy diet, make sure you get enough sleep, good sleep hygiene, no caffeinated beverages at night. All of those things will keep your depressive symptoms to the minimum. If you do find yourself getting discouraged or thinking troubling thoughts about not wanting to be here anymore, if you get so angry that you're snapping at people, it might be time to talk to your doctor and ask for help. Counseling can help. Not everyone needs medication, but sometimes medications in these instances can help as well. So just remember, holiday time is time for cheer, but depression peaks this time of year, and if you need help, ask your doctor.
For these stories and more, you can visit our Facebook and YouTube pages for every episode of Sinai-Grace Today. Also, log on to pagingdredie.wordpress.com for great health information. I'm Melanie Moss. Thanks for watching.